As South Florida's COVID positivity rates continues its downward trend, the push and pull continue over loosening rules and restrictions.
This week, among other developments, the governor looked for advice from the White House health advisor who wants to stop testing asymptomatic people. He wants to follow the example of Sweden, which was not that successful. So what are the implications for us? Let's ask our go-to source for expertise on all things COVID-19, Dr. Aileen Marty. She joins us from Miami Beach. Dr. Marty, good afternoon. Good to see you.
Good afternoon. Great to see you guys.
Let's begin. We'll get to Dr. Atlas in just a minute, but here we are, as Glenna said earlier in an interview, the bookends of summer. We had Memorial Day, now we have Labor Day. Memorial Day produced a huge surge. I mean, by July, as you well know, the hospitals were jammed. We had many sick people dying. So what is your expectation here for Labor Day?
Well, I do think the community has gotten the message that they have to be careful in these family gatherings, and everyone is well aware of what happened after Memorial Day. So I'm really hoping that people will keep all that in mind so that we don't see a huge surge 2 weeks from Labor Day, which is when we would start to see cases rising as a consequence of any excessive behavior during Labor Day. Or it isn't excessive behavior, it's normal behavior that can't be done during the pandemic.
Do you see, Dr. Marty, the difference in those two holidays in the atmosphere and the knowledge and perhaps the buy-in of just generally people going about their business much more open now than was after Memorial Day, but many more rules in place as well? And although there's been pushback, we know on those, what are you seeing in the community? Are you optimistic about that?
I'm cautiously optimistic. When I have to go to the clinic or out and about for a variety of reasons, I do see many more people complying with the concept of physical distancing and the use of masks, and better use of masks than I saw at the end of May. So there is a shift in the community. There is an awareness that we just went through a horrific time. And I think business owners are acutely aware of how incredibly important it is to work with us, because they know that if the situation gets very bad again, we'll have to start walking back some of the openings that we've done, and no one wants to do that.
Yeah. Dr. Marty, this week or in recent weeks, we have seen the president turn to a new medical advisor for help and direction on coronavirus and COVID-19. His name is Dr. Scott Atlas. He is a neurobiologist, radiologist at Stanford, and he has a quite different approach to it. I want to run a couple of sound bites from Dr. Atlas and have you react.
Herd immunity. It's very important that that develops. That's how viruses are eradicated. Population-based immunity, which is the most immediately available way to get rid of this threat.
All right, so you heard him there. He says herd immunity is the way to get rid of this threat. Explain what herd immunity is and does it work?
So the concept comes back to the early 1900s and ranchers talking about how to protect their herds from any particular type of infectious agent. And they recognized that when a large population of the herd, a large percentage of the population of the herd was protected, it protected those animals that for whatever reason could not be vaccinated or protected in some way from an infectious agent. So that's where the term comes from, and it applies to infectious diseases in general, because many diseases, but not all, we can develop this kind of long-term immunity in a population that has to be somewhere upwards of 85%, ideally 95 or 98%. That's what we really look for. And that's what the whole concept of vaccination is all about, and trying to have as many people vaccinated for something as possible to reduce the level of threat. Having said that it's a real concept in immunology, and And I find it surprising that there's someone with absolutely no expertise in infectious disease providing this information, because he has none. He's also failing to see the most important aspect, which is how do you get there? And when you let a wild and destructive and dangerous virus simply infect people, that means that a certain percentage of people are going to end up ridiculously sick to levels that we have to hospitalize. And again, if we just let the virus run wild, then we'll have so many people in hospital that once again it becomes very difficult to manage, and it's much harder to use the modern medical tools that we have to keep people from dying, even those that we might otherwise save if we didn't have unbelievably high numbers of cases at the same time. So not only is this going to lead to more deaths simply because there are more cases, but from the percentage that would die because they have such overwhelming disease, but also because when you have an overwhelming number of cases, it's even harder to treat those that you might otherwise be able to save. So it's a death sentence for a lot of people to have this particular immunity. It's much better to accomplish herd immunity with a safe and effective vaccine, which is what we've been working towards for months now. And it would be really unbelievably tragic that when we're at the cusp of having something that could get us completely out of this pandemic and create herd immunity safely, that we would let things run wild.
Yeah, if I may, your point of view has been echoed by Dr. Tom Frieden, former head of the CDC. He said recently, trying to get herd immunity other than with a vaccine isn't a strategy, it's a catastrophe.
That's right.
So,
I know Dr. Friedman, and I totally agree with him.
Now that we're talking about vaccines, a good time to bring up some bit of news that surfaced in the last couple of days that I'm guessing is going to be really concerning, is that when this vaccine process on the fast track, and we may or may not have something by the end of the year to talk about, but polls that have been taken this week show that there is a significant number of the population that will not submit to that first vaccine, and 1 in 4 people who just won't choose to get the vaccine at all. Does that sound like something that is generally what happens with new vaccines, or is that concerning to you?
Oh, it's extremely concerning, but it has to do with a lot of false advertising from all levels about how vaccines are made and when they're safe and when they can be done. And I don't think that what's going on right now in our government is providing the kind of assurance that people need to realize that we will have a safe and effective vaccine that they can feel confident in. I need to see the data, the real data from the results of at least 6 months worth of a phase 3 trial, with having multiple people from multiple different walks of life and races and genders and so forth, before I would recommend that a vaccine is good, safe, and effective. So we need time to develop that vaccine. We're working on it. I'm cautiously optimistic, as is Dr. Fauci, that we may have something by the beginning of 2021 that may be safe and effective. And I think that people should understand that those of us who are looking for the right solution will not recommend a vaccine until we know it is safe and effective. And once we do, then I think that people can feel confident that we're speaking from hard science, which is what we will do, people like myself.
Dr. Aileen Marty, always the voice of scientific reason that we love to have. Thank you so much for your time today.